Dr. Mitchell, thank you. Health officials said today that in New Mexico, hospitals will almost certainly move to what the state calls crisis care mode by the end of the year. And that means potentially rationing care. How do you decide and who decide who gets treated and who does not?
I think it's really important to recognize that as we move into a crisis standard of care, the goal is to expand services so that we don't have to ration. We can bring in physicians and nurses that normally practice in clinics into the hospital. People can go outside of their scope where they didn't do ICU work and be in the ICU. And so we will do everything we can not to have to ration. Additionally, we'll use places we don't normally use, and whether that's tents or clinics to put hospital beds, we really will do everything. And that's what we're focused on, is trying to do everything so that you can't so that you don't get to that point.
Of course. What would any other health professional ever do? But your crisis is escalating in ways that were not predicted. And if it comes to that point, which the health director for the state says it likely will, who decides?
Yeah, it's a great question, and it's something our state's been working on for the last 6 months. So we've had physicians, nurses, ethicists, academicians, pretty much people from the state working on an equitable way to do this. And we actually put together crisis standards of care document that outlines an equitable way to do this with standard scoring that is objective, meaning things you can read, and put it all together to make sure that we give as many resources to as many people as possible. The other important thing is that we all do it together. So every healthcare organization uses the same criteria, the same mechanism to ensure that equity and to ensure patients are distributed across the state so that we give as much care and save as many lives as we can.
Doctors on the national level tell us that you may be the beginning, but sadly, you're not the end. This is a problem that Americans are going to face from coast to coast unless we get this under control, and there's no sign that that's happening. I talked to a couple of doctor friends who said, I took a Hippocratic oath. I went to medical school to save and to serve and to treat and to heal. And this sort of a reality never even occurred to them. What does that do to your mind as a healthcare provider, knowing that some may not get care?
It is a really hard thing for a healthcare provider. I think in New Mexico right now, we believe we're going to peak in December 17th. And so we actually see a place where we'll peak and hopefully come back down. But even then, we're exhausted. We live to serve. It's what we do. We care for our patients, every single one. And the thought of not having what you need for every patient is just crushing. I think that's why it's so important that we support our healthcare providers, and something we do at Presbyterian. We've really worked hard to support our clinicians and give everything that we can, because we know that there's a lot of suffering on the inside when you have to make those hard choices.
Dr. Jason Mitchell, all the best to you and everyone there, and thanks so much for your service to all of us. Shepard Smith here. Thanks for watching CNBC on YouTube.